All right, well, welcome everyone to the 2023 PI Conference. My name is Megan Messick, and I'll be your moderator for today's session, The Emotional Landscape of Chronic Illness. Today, we'll be hearing from Kaylee Bradley, and the content that you're seeing today is a pre-recorded session in which you'll hear a 25-minute deep dive into the emotional and psychological impact of a chronic health condition. We'll also have a brief Q&A to close us out. But a little bit more about Kaylee. So Kaylee earned her Bachelor of Arts from Mount Vernon Nazarene University in 2012 and finished her master's in clinical mental health counseling at Ashland Theological Seminary in 2015. Kaylee is a licensed professional clinical counselor with supervisory designation in the state of Ohio and is a board certified counselor. Kaylee also received the certification in Thentology from ADEC. Kaylee has a background in hospice work and feels that companioning and advocating for grievers is her life's passion. Kaylee's goal through her trainings, groups, and individual counseling sessions is to create a refuge where the normal plethora of emotions of grief are normalized and accepted as valid. Kaylee specializes in working with individuals of all ages with special interest in caregiving to children's bereavement, complicated grief, perinatal loss, and chronic illness. Kaylee worked for 4 or 5 years at a local hospice agency and has provided over 50 workshops and trainings on grief throughout her career thus far. Kaylee also has conducted over 100 grief support groups and has a passion for research on methods and strategies for offering creative and engaging bereavement support groups for children. Currently, Kaylee is an adjunct professor at Ashland Theological Seminary, where she teaches grief and crisis counseling courses. Kaylee is also currently a doctoral student at Ohio University, studying counselor education and supervision. She also co-owns Refugee Counseling, LLC, a private practice specializing in the intersections of grief, sexuality, chronic illness, and spirituality. Kaylee, we are so lucky to have you today, such an expert on this topic. What I'll go ahead and do now is exit out of screen share and allow you to pull up your slide deck.
Great. That sounds wonderful. Thank you for that kind introduction. All right. Hopefully my slides will cooperate here, and it looks like they are. Wonderful. Okay. So thank you so much for letting me chat briefly this morning. Let me there we go. All right. So as Megan kindly said, my name is Kaylee. I'm a licensed professional counselor. And though my biography hinted at my background in grief, what I have found through both my personal experience and professional experience as a counselor is that the grief of chronic illness often gets very minimized. So that is a piece of what we'll talk about today, as well as just kind of the wide range of emotions that many of us experience as we navigate chronic health conditions. My personal experience and expertise kind of in this topic, I happen to be diagnosed with common variable immune deficiency. I was actually diagnosed fairly recently, only back in 2020. I'll share a little bit about that process as we go along this morning. But certainly, this gave me a whole new lens on mental health support, kind of some of the gaps, right, that are evident for many of us navigating primary immune deficiencies. Okay. So kind of my main idea, I like to say when I do trainings, there's sometimes a little, one nugget that I'd like you to walk away with. And I think this is it here, that understanding the emotional landscape, right, of patients with chronic health conditions improves, right, health outcomes, okay, develops better patient-provider rapport, increases effective communication, okay. So when we focus on relationships and the whole person, right, we can better help our patients. And this is true whether you're a medical provider, a counselor, whether you're a caregiver for someone with a primary immune deficiency, okay? This whole presentation is kind of going to be about how do we do that, right? How do we really prioritize the relational safety between two people? Okay, so kind of want to define what I would say is, quote, the problem, right? The problem is that the emotional impact, I think, of chronic health diagnoses is not often discussed, right? Sometimes we get a lot of information when we're diagnosed and it's super overwhelming, right? But one thing that I don't think really is talked enough about is the grief, right? The confusion, the anger, the frustration. I'm going to give you a whole list of, I think, some pretty common emotional expressions that we experience, right? We're going to talk a little bit today also, and I know the time is limited, so we'll kind of go through a lot of this quickly. But certainly, if there are things that you want to discuss with me further, I'll provide my email, and we can certainly facilitate those conversations. But one of the other things we're going to talk about is trauma-informed care and the importance, right, of developing relational safety as primary in interaction with patients. Okay, we're going to identify the emotional landscape, and then we're going to kind of have a call to action here at the very end, right? Some suggestions, some considerations, right? Things like trainings. How do we communicate? Okay, and the importance of referring, right, to mental health providers if that's needed. Okay, so why did I kind of choose this language of a landscape? Well, I think it's a metaphor that I think really captured my own experience, right? It's the way in which I felt when I was diagnosed in early 2020. I couldn't quite see what was going on or what was up ahead, I should say. I felt like things were constantly shifting, right? Based on where I was standing, okay, or what I was experiencing. Kind of felt curvy, mountainous, confusing, etc. Okay. As I've already shared, when I was diagnosed in 2020, it had been a long kind of couple of years trying to figure out what was going on, right? Had some symptoms that just were not fitting with some of the prior diagnoses. But it was filled with grief, particularly because I had to change my job as a result of this diagnosis. Okay. And then again, this emotional landscape had what I call potholes of anger that kind of tripped me up. Right? Often when a diagnosis occurs, the focus is on the physical, right? This makes sense, right? However, the emotional landscape is constantly changing, and having awareness of the whole patient is beneficial in numerous ways. And we'll talk a little bit about that. So how do we begin this process? How do we focus on the emotional landscape of a patient? I think it really comes down to this. Let's start with relational safety. Okay, I love this quote. This is by Dr. Stephen Porges. He is a clinician who came up with a trauma-informed modality of counseling called polyvagal theory. We're not going to get into too much about that, but I love this quote that safety is treatment and treatment is safety. Okay. If I were to, be, doing this presentation with you all in person or live, I would ask you to kind of define relational safety. And I would do that by asking, how do you know that you feel safe with another person, right? What's that experience like? What's going on physically when you feel safe, right? You might say something like, I just feel kind of relaxed. I feel validated. I feel like my experience is being heard and acknowledged. Okay. So it's a question worth reflecting on. Okay. So as a counselor, I consider myself trauma informed. Okay. Which means that I'm constantly aware of the emotional manifestations of whatever I'm experiencing, right? So trauma informed care is a part of the interaction I have with my clients as a counselor. Okay. And I think it's important because trauma impacts our sense of safety with others, right? So when we talked about relational safety, trauma kind of disrupts that, right? Okay. I think we need to be aware that for many of us with chronic illness and we're engaging with our providers, we may have medical trauma, right? Our nervous system, which is very impacted by trauma, may be activated, right? And resulting from that, we may not be able to fully grasp what is being said by our providers, okay? We may need to go slower. We may need to have more time spent on developing rapport and relational safety, okay? So developing relational safety, I kind of label these next couple of slides in the zone, right? So in trauma, we can experience what we call fight, flight, or freeze. Okay. I want you to kind of reflect as you look at this image, maybe times that you have felt in the fight or flight, right? That is where we are just ready to get out of there, out of the situation, right? I want you to also think about times when you have felt frozen, right? Kind of completely shut off from what's going on around us, okay? These zones are really common in trauma, okay? So I think as providers, we have to be aware that our patients who are coming in and dialoguing with us, they may be experiencing this phenomenon, right? Okay, they may feel activated based on prior histories of trauma, whether that's medical trauma or other traumas that they're encountering, okay? So in the green zone, as I call it, is when we're not in fight or flight, okay? We're engaged, our nervous system is relaxed, okay? We're able to really sink into that relational safety, okay? I asked this as a question, how might it be helpful to know what zone our patients are in? But I think I would actually just make that a statement instead of a question. It is helpful, okay? I think it's also helpful to acknowledge our own stuff, helpful to acknowledge what zone we're in as a provider, okay? And then what can we do to leverage this relational safety? This is this green zone, okay? And I know we're going through these quick, so please email if things aren't making sense or you want to kind of have further conversation, okay? I want to kind of go back a little bit just so we're kind of aware of some of these other zones that our clients might be in. The red zone, right? This is that fight or flight. Okay. I want you to think about if you're trying to give a lot of information to an individual when they're in the red zone, they're probably not going to be able to digest a lot of that, right? Okay. Our sympathetic nervous system, we've been activated, right? Okay. Again, as I've already said, we're in that fight, flight, freeze, or what is also can be known as the fawn mode. And I won't get into that a ton, but basically that's another kind of way that we may, kind of be adapting to our activated nervous systems. Okay. But again, by and large, when our clients are in that zone or our patients, they're not going to be able to digest a lot of that information. Okay. The blue zone. Okay. This is when I say we are completely frozen. Okay. I apologize, I moved too quickly on that slide. We are not able to really even engage, right? That's when our trauma and our activation has become so intense that we're shut down, okay? So again, there's not going to be a lot of good clinical work being done, right? If our individuals that we're working with are in the blue zone, okay? Again, I want you to think about, okay, so we've talked about these different zones, how it's important for our clients, right, to be in that green zone where relational safety can really be important. But how do we know when we are ourselves are in the green zone? Okay. Again, we're probably calm. We're probably able, right, to engage, to take in a lot of information. Okay. We're asking good questions, right? So you might be like, well, what does all this have to do, right, with chronic illness? Right? Because as I've already hinted at, many people with chronic illness, and I would include myself in this, have past experiences of medical trauma, right? And so those different zones are very, very real, and they impact our present reality, right? Even if it happened in the way past, right? Okay. So this causes all sorts of different feelings, like anxiety. Okay. What will the doctors find now? Right? A fear. Okay. Are they going to believe me? I know for myself, this was probably the most prominent emotion that I was experiencing before my diagnosis of common variable immune deficiency. Okay. I had other health diagnoses growing up, and there were times when I felt that I had to kind of put on a brave face because I wanted them to believe me, right? And if I was seen as more, quote, put together, I felt that they would believe me more. Okay. There's some hesitancy, right? I worry if I mention this, right, are the doctors going to think I'm crazy? Okay. And I know Megan has some questions about some of these different emotions when we get into the Q&A session here in just a second. Okay. But yeah, hesitancy, worry, fear. Am I going to be believed? Anxiety. Okay. What other emotions? Okay. This is by no by no means an exhaustive list, but these are some things that I have personally felt and also seen with many of my counseling clients. Okay, that I see in my private practice. Grief, I've already mentioned that. Loneliness, this was something that was really prominent for myself, trying to navigate my new diagnosis that occurred just about 6-7 weeks before the world shut down because of COVID-19, right? And due to insurance, I wasn't able to start my IG replacement therapies until June of that year, right? So there was a period of time where there was a lot of, gosh, I'm not sure what's safe, right? I don't know how to engage with the world around me. Okay. So loneliness, isolation, right? Everything kind of shifted for me. My job prior to this diagnosis was a very active job where I was in and out of a lot of hospital settings, nursing homes, etc. And all of a sudden that wasn't safe, right? And so I had to switch jobs and I was counseling online virtually, and I'm very thankful for that, but it was different, right? And so I had to kind of make that adjustment. Confusion, right? Our immune systems are so complex, right? And so there was so much information that I was getting that, gosh, I am not a medical provider. I'm a counselor, right? And so it was very hard to truly make sense of, gosh, what is IG replacement therapy? What is, what is an IgG level? I mean, there were so many things that were coming at me that was very confusing, right? Okay. Some guilt. Did I do something to cause this, right? Okay. I think for many of us with chronic illness, we worry like, well, if I had just eaten healthier, right? Okay. Or, oh gosh, maybe if I just relaxed more, etc. So there's some guilt, right? Did I do something to cause this? I've already mentioned the isolation, right? It was very hard to explain to folks exactly what I was navigating, right? Trying to explain this rare diagnosis, trying to explain that I would be getting treatments for the rest of my life. What was that going to look like, right? Trying to explain that sometimes I have days where I feel okay, and then other days, the fatigue, right, of a primary immune deficiency, it really is a lot. And there are days where maybe I had planned to do certain things with a friend, and you know what, just due to the day in day out toll of the emotional labor of chronic illness, it just wasn't going to happen, right? So isolation again, frustration on so many levels, right? Trying to figure out, okay, why is insurance giving me a hard time about approving this treatment, right? Frustration about, oh my goodness, this medication is expensive, right? Trying to locate, okay, how can we get some of that reduced, or how can we leverage insurance deductible? Anyway, right? Frustrating. Frustrating. Okay. So all of these were emotions that I have felt personally, but also seen with my clients. Again, there's so many more that you might add to this list. Okay. I want to move a little bit to some things that I think are helpful in discussing this emotional landscape, right? I think psychoeducation, and what I mean by that is really preparing clients for the emotional component of a chronic illness, not just providing information on the physical, right? I think in our culture, we do a disservice when we divide, right, the emotional and physical. I think they're very interconnected, right? So psychoeducation about, hey, you know what? This is a lot, okay? Here's what you might expect emotionally, okay? Prioritizing relational safety. We spent the first little part of this training on that. Validation. Oh my gosh, right? if there's anything I want you to take away, it's probably this as well. Validating. This is hard. It's a lot to navigate. Okay. Checking in, right? As the conversation's unfolding, particularly around diagnosis. Okay. Making sure that, okay, are you understanding what I'm saying? I know this is a lot. Do we need to take a pause? Okay. What questions do you have? Okay. Validating that you may have questions much later on after the diagnosis, right? Again, you're getting so much information that questions may pop up later, and that's okay. That's normal. That check-in is really important. Referrals. I think this is also super important. Having a list of mental health professionals that you can refer clients to, if possible, right? Okay, finding mental health counselors in your area that specialize in chronic illness. If you're a medical doctor, I think, linking to mental health providers is very important. Okay, you can certainly email me if you need help on, okay, how do I do that? How do I, find those referrals? Okay, but I think just having that list can be very helpful. Okay. So just to kind of summarize, and then we'll move into the question and answer component of this. We talked about a lot very quickly. So I think this summary is important, but I think we can be present to our patients by allowing them to experience the full range of emotions that come with having a chronic health condition, not just focusing on the physical symptoms. We can start this process by building that relational safety. We can consider how we communicate, providing psychoeducation, and offer referrals. These can all be practical ways that we can focus on the whole person, not just the physical symptoms. So that is kind of all of my slides. There's my email. It is just my first name at allrefuge.com. And I will kind of turn it back over to Megan for our questions and answer kind of component of our presentation.
Wonderful. Kaylee, thank you so much for that incredible presentation. Yes. I think these are going to be incredible resources for our community to be able to learn from you today. And we do have some time available for Q&A. Before we begin, please everyone remember that treatment and conditions are unique. The information presented during this session is not medical advice, nor is it intended to be a substitute for medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with questions concerning a medical condition. But our first question, Kaylee, so, in discussing the emotional landscape, you touched on that fear component, a fear that someone won't be believed while sharing an experience in their doctor's office. Can you talk a little bit more about how you've seen this play out or experience in the PI community?
Yeah, absolutely. It's a great question. I think, again, even for me personally, one of the things that, kind of cued my doctors that something was going on is just the frequent infections. And I often felt really embarrassed that I kept having to go back to my doctor and be like, I'm sick again. I'm sick again. They're going to think I'm a hypochondriac, right? Like there was that fear for sure in my own experience of like, gosh, what are they going to think that here I am again with strep throat? And I've seen this a lot with my clients in my private practice, just that sense of maybe having had an experience where they weren't believed by a doctor. And then that carries on to future medical care. And that's where I really think that, advocating for yourself is really important. And really kind of that self-validation can be really key. But my goodness, I think because, primary immune deficiencies, there's just not enough resource and knowledge yet. I mean, we're getting there and I'm very thankful for that. But sometimes, our doctors just aren't aware, right? And so again, if you think that there's something going on, I always say to my clients, never be afraid to ask questions. I think that can be really, really important.
Thank you for that. And I think something you touched on too, when you talked about, am I going to be thought of as a hypochondriac? Is that medical gaslighting experience that we do hear so much of in our community where, not to even say that, it's one thing or another and being improperly diagnosed, but the concept that you may go in and be made to feel like that experience isn't real. So I think that can happen in a lot of medical communities, but especially as you mentioned, our rare disease community where that's an experience that a lot of people have.
Yeah. And I think unfortunately too, as a woman, sometimes
Mhm.
I'm more likely to just get brushed off, right? As, oh, you're just stressed or you're just, emotional. And I think that that can also, again, we then, I don't think are fully honest with our providers if we're like, well, gosh, if we're going to be, treated in that capacity, of course we're going to shut down and not
Right.
want to bring things up.
Oh, of course. And today, you've also talked a lot about how clinicians can create that space for inclusion
Yeah.
of mental health. And for those
Yeah.
who are listening, who may not be in the clinician community, be it in the patient
Yeah.
community, do you have any
Yeah.
suggestions on how they can go about advocating for themselves if they're in a situation with a clinician where they feel like
Yeah.
that critical component of their mental health really isn't being addressed or
Mm.
included in the puzzle?
Yeah. I would first and foremost say that there is never any shame in asking for a mental health referral. I know that there's still some stigma, right? I know there's also access issues. It can sometimes, frankly, be hard to find providers for mental health in the mental health spaces. But I would say, again, there's no shame in asking your doctor for that, right?
Mhm.
Um, I think that's also why I put in the slides. I think it is important for medical doctors to have lists of folks that they can refer to. I think it's so key. But yeah, I think if you feel like, you know what, I would just benefit from being able to process, right? This is a lot to take in. Maybe it's just one session, right? Or maybe it's an ongoing relationship that you develop with a counselor. I think just having a space where you can talk about, you know what, this is hard. I'm lonely, I'm frustrated, etc. That can really be such an important part of our overall just kind of well-being. I will say for individuals who may want to find a counselor, Psychology Today is a great website that just has a list of counselors, and I like Psychology Today because it also has a space for providers to say what their specialties are, and so you can even look for somebody who might be a specialist in chronic illness. I also, as a counselor, always say to folks, you know what, if you don't like the first counselor you end up with, that's okay. You can try again, right? You're not beholden to the first counselor that have interaction with. You can try another provider if it doesn't feel like a good fit. So those would just be some tips that I would offer, a patient who's maybe, again, maybe just newly diagnosed or
Yeah.
just really needing a space to, again, process through the ups and downs of having an immune deficiency.
Oh my gosh. And the point you made about, and I think many of us have been in these shoes before where, you've seen a new clinician, a new mental health provider, and they're not the right fit, but you're like, oh
Yeah.
gosh, like what are they going to think if I don't come back again? And being able to
Yes.
redirect yourself in the moment to what will happen to me in my situation if I can't advocate for a
Hmm.
different, better situation and being able to kind
Absolutely.
of rechannel that. No, I think that's so important.
And I think it's important too for folks to know that many counselors will offer free, like 15 to 20-minute consultations. And so you can always reach out to a provider, get a feel. I know at our practice we offer that, and it can be very helpful for folks to say, you know what, I felt okay about this. Let's give it a try. And then we've had other times where an individual may be seeking something that is kind of not outside of our scope or something we offer, and then we can help them find a provider that might be a better fit. But yeah, I think there is no shame in saying, you know what, I think I need to advocate for a different provider, or um, yeah, looking for somebody else.
Right. And here at IDF, we are resource tool driven. We love being able
Yeah.
to ensure that our community has that right information. And I know you've given out such great
Mhm.
advice in this talk. I want to hear a little bit more about if there are specific training or courses for the clinicians who are listening that might be able to help them take that next step. They've heard your presentation and they thought, oh my gosh, I've got this knowledge gap that I would like to grow
Mhm.
in. What do you recommend for increasing, understanding of that trauma-informed response?
Yeah, I think for me, even in my training as a counselor, it was really there was even a gap in my training in as far as being trauma informed. And one of the things that really shifted for me was when I read a book called The Body Keeps the Score by Dr. Bessel van der Kolk, which was really eye-opening and illuminating for me to begin to think about. Often, we ask, what's wrong with you instead of what's happened to you. Like
Mm,
and that simple shift in perspective is huge. I think whether you're a counselor, a doctor, or even just another human engaging with another human, right? That subtle shift, that behavior is often just the tip of the iceberg of what we're seeing and what a person's experience is. And so that shift is such a good place to start. But The Body Keeps the Score by Bessel van der Kolk was a
mhm,
really illuminating book for me. Um, Another one is called My Grandmother's Hands, which is
mm,
a beautiful book about trauma-informed care in the intersections of racial inequity and how that can play into both physical and mental well-being. And I can certainly, provide other book resources. And I think certainly any trauma-informed training or workshop that you see in your communities, I think that's always useful. If you're a mental health provider, watching this, if your community doesn't have trauma informed trainings, maybe consider offering, something like that. I'm actually very fortunate in my small community here in Ohio. We have a wonderful mental health and recovery board that does a lot of trainings on trauma informed care. So reaching out to your local mental health and recovery board might also be a very good place to start, just to see if they offer any trainings. And I certainly think our own personal reflection is a great place to start. So maybe pick up Body Keeps the Score and just really start thinking about, that shift in perspective from what's happened to you, or from what's wrong with you to what's happened to you.
mm. And Kaylee, I'll laughingly will add, the creation of audiobooks has been such a godsend when it's come to
Yeah,
things like this. Instead of it
absolutely.
being, I know especially the people on today's call are folks with limited amounts of time, and being able to just
Absolutely.
listen to 10 minutes of it on that car
Yeah.
ride to the grocery store, yeah,
Yeah.
every little bit helps. So
Yes,
thankful for those
absolutely.
resources that you've
Yeah.
provided. And I think many of our community members
Yeah.
will appreciate and enjoy.
Absolutely.
Well, that was Kaylee, my last question. And I know our time together is coming to an end today. And
Yeah.
I just want to thank you again for being here, and to also share with our folks who are listening that this session is one of 39 unique learning opportunities provided through IDF's 2023 PI conference. So a lot of different learning opportunities that you'll be able to access over this 2-day window that we hope will help you in your journey of gaining access, information, and resources, and understanding PI, and supporting those with PI. So just as a reminder too, I know we talked through some questions today about the presentation. If you do have additional questions as well, I also like to encourage folks to visit our Ask IDF platform. And that's a place where we can follow up with you all individually regarding specific questions, or if someone says, hey, I can't remember that name of the book, message us
Yeah.
as well, and we're happy to help. But
Wonderful.
again, we want to make sure that you guys always have the resources you need. And Kaylee, thank you for being one of them today in our session.
Absolutely. Absolutely. Thank you so much.
All right. Well, thanks everybody. Have a great day.